Welcome back to Alberta Primetime and our nightly vocal point now. The Thursday Health Panel is here on a momentous day for 28,000 elderly Albertans and their families. The Supreme Court will allow a $100 million class action lawsuit against the Alberta government for allegedly driving up nursing home fees to cover medical costs that it should have been providing as health care. Let's see what our doctors think tonight. Dr. Donna Wilson is a professor of nursing at the University of Alberta. Physician and addiction psychiatrist Dr. Charles Els joins us as well. And in Calgary, Dr. Linda Slocum, physician and president-elect of the Alberta Medical Association. Welcome back, everyone, to Alberta Primetime.
Thank you. Good evening.
Donna, the class action lawsuit can proceed now on allegations that seniors are paying artificially inflated accommodation fees to cover medical services, services the suit alleges the government should have been providing anyway. Explain this for us. Give us some examples.
Okay. Well, basically, the point that the Supreme Court made today was the fact that this is a very vulnerable group. They really can't live anywhere else but nursing homes. So the increase of 40% to 48% overnight with no notice whatsoever.
Back in 2003.
Back in 2003, August 1st of 2003. Basically, that meant that whereas before they could get by on their pensions and still maybe have a little bit of money for haircuts, clothing, what have you, basically that meant that they really couldn't almost afford to live in a nursing home. And at the same time, the regional health authorities were getting 27% increases, and so there was the money that was collected extra off these nursing home residents who, again, couldn't afford to, live anywhere else, couldn't really live anywhere else. They need that level of care. That, in fact, that the idea then is that they, in fact, started to pay for their nursing care, which should be covered under the Canada Health Act.
But they were paying for that under the heading accommodation.
Absolutely. This is they're supposed to pay for their accommodation, their hotel fees,
yeah.
their meals, and the building around them, the electricity, what have you. But again, it's not the nursing care, the medical care that they require to live, which is covered by the Canada Health Act.
Linda, what the lawsuit alleges seems so underhanded to be charging these vulnerable people for medical expenses and calling it accommodation. The Canadian Medical Association said a year ago there should be a uniform way to separate medically necessary parts of long-term care from accommodation. Isn't it the province's role to ensure nursing homes and long-term care facilities are billing people appropriately?
Well, absolutely. I think what we're seeing, and one of the reasons for this lawsuit, I think, is that increasingly the financial burden of long-term care is being put back onto the public rather than the government responsibilities. We have to remember that long-term care is by itself, the medical part of it, not covered under the Canada Health Act. And so we have wide variations across the provinces, and that's one of the reasons that the CMA, the Canadian Medical Association, in 2010 said there needs to be standardization to try and decide provincially, but the same across Canada, what determines medical care and long-term care and what determines accommodation fees.
Right.
There would be some comfort with maybe an increase if we were seeing increase in quality of care in the long-term care, but I'm not so sure that we're seeing that.
Charles, I don't know if the magnitude of this story has hit a lot of people yet. The decision just came down 9-0 from the Supreme Court today. Yes. It's a little bit staggering to think of this happening, and now it will be years for a lawsuit to sort it out. Help us out here.
I have to admit, I was staggered this morning. We were waiting at 8 a.m. Mountain Time for the Supreme Court verdict. When it came out, I was surprised the Edmonton Journal only picked up several hours later on the story of this magnitude and this gravity. It's a huge story, and absolutely, this is a massive victory for the elderly population, many of whom are disabled, many of whom may suffer from mental illness. So this is a story about empowering people who are not able to speak out for themselves.
Because in fact, the Supreme Court also ruled today that the Edmonton-based lawsuit, now 28,000 people involved in it,
yes.
Could proceed not only on the accommodation versus medical care expense issue, but also on the issue that this billing was a form of discrimination based on age and disability.
Again, you need to understand today, what happened today was was not that government was found guilty of any kind of misdemeanor or offense. What this said today is there's sufficient ground for a class action to proceed. And the Supreme Court looked at 5 different categories under which this should proceed. They struck 3 of those and decided to proceed with 2, including undue enrichment at the cost of seniors.
And the other thing, the equality as well, too, that these are very vulnerable people who are equal to the Canada Health Act, the nursing care and medical care under the Canada Health Act. So they now, as a separate group, are starting to pay for their own health care.
And the bottom line is, each and every single elderly individual under these circumstances would not be able to individually take a case forward.
Right.
They do not have the voice to do it.
Right.
And that's why this class action is especially important.
I guess, to be fair, we have to think about things from the government side as well. Huge healthcare costs, a very difficult balancing act, you know, taxpayers demanding a balanced budget. Linda, can you help us understand why this happened from the administrative side?
Well, I think it's going to be one of our largest issues in healthcare, and that is the cost of long-term care. And, you know, it's not just the elderly. We have young people who are also disabled who are requiring long-term care. So how are we going to fund it now and in the future? The CMA also in their transformation document says the federal government needs to seriously look at how this is going to happen and how do we increase funding. We need to look at support for caregivers at home, and we need to look at ways of funding such as private long-term care insurance or tax deferrals or tax credits, something that will help.
To disagree.
I'm just making a lot of suggestions because we need to look at different ways to fund it.
Yeah.
Okay,
So,
Donna, what do you think?
Well, it really concerns me, again, the people that go into nursing homes. Remember, there's only 13,000 nursing home beds in Alberta. That's a very, very small proportion of the population that end up in a nursing home. They're the ones who really can't walk. These are the people that can't feed themselves. They need 24 hours care. A very, very small proportion of seniors and a few younger people that need this level of care. And asking them to pay $50 a day, which is roughly now, because we've had another increase, is about what you pay.
$55, I think, now for a private room
Absolutely,
per day,
$55
which is about $1,700 a month.
Absolutely. Now think about the last time that you went into, you know, a hotel. I mean, there's many places where you can get a pretty nice hotel still for about $50. But again, if you're a disabled senior and you're trying to get by on a very small pension, that's a phenomenal stressor because again, you have no money for your clothes, you can't get a haircut, all those extra things that now are also tacked on top of that bill. It used to be that
well, particularly if you're paying for medical expenses that should be part of your public health care.
Absolutely.
This lawsuit will take years to unwind, and we've had doctors, you've told me before the show, it could change the entire landscape of long-term care.
Absolutely, but it could also be settled outside of court in advance of many years of expensive legal fees.
Okay.
And I think that's what the government should do, or Alberta government should do.
We will see if that's what happens. A lot of people making predictions that very may well be the case. Next up, some doctors are telling governments to use sin taxes and legislation in Canada to curb junk food eaters. Would it work? Would it be fair? That debate in a moment. Laws and taxes to deter obesity? An article in the Canadian Medical Association Journal says government should legislate who can sell junk food and where. Not near a school, perhaps. And sin taxes should be slapped on foods that exceed daily recommended amounts of sugar, fat, sodium, and calories. Charles, what do you think?
Well, there's no question the number of people in Canada with obesity are on the increase. So clearly this is a health problem we need to curb. I firmly believe in freedom of expression, freedom of choice. I do not believe we need big government to tell us what to eat or how many hours of television I can watch at night.
Or what to smoke or what to drink?
There's a difference between addiction versus certain lifestyle elements. Obesity is a medical condition, but not all people eating are obese.
Okay, Donna?
Well, I have to completely disagree. I really, I guess I've had a chance to look into the research on what they call sin taxes, and they work. I mean, we would all speed if there weren't some rules on the road. I have no doubt that cigarette companies, you know, if there wasn't kind of tobacco companies, if it wasn't controlling on it, that they'd be handing out free cigarettes to kindergarten kids to hook them. I mean, I think we're looking at some huge public health issues that need new taxes, new regulations, what have you. Why should pop, which has nothing good in it for you, why should that be 1/4 the price of milk? Why can't it be the same price?
Linda, what's your take on legislating obesity?
Well, first of all, the article talked about a multi-pronged approach to obesity, which is a huge problem. So sin tax, or if you want to call it a sin tax, was just one of the things that they talked about. And I agree with Charles that obesity is not always caused by eating junk food, right? Some people just don't exercise, or they have wrong genetics. But so there's a lot of factors that go into it, but it is something that needs to be addressed. I think importantly, we need to focus on the kids. So absolutely, junk food pop has no place in the schools. If you're going to use a tax, which some places have, then make sure that the money that you collect from that goes back into education, into healthy foods. You know, some people actually suggested, which seemed like not a bad idea, if you're going to tax the junk food, then lower the price on healthy food.
It's spot on. The problem is it's close to impossible to get dedicated taxes. For example, the tax on cigarettes will not go to tobacco control. The tax on alcohol products,
research.
Exactly, will not go to minimizing problems related to alcohol. There's a lot more we can do than getting big government telling us what to eat.
Cheryl, what about the idea of legislating the food makers? Look at sodium, for example. Campbell's soup in Canada, more sodium than the same can of soup in the States. Why? Because the maker thinks that's the taste we like. What about legislating the manufacturers?
I think we need standards by which we determine what foods or what the content should be in consumer products. And if consumer products do not meet the standard, it should not be on the market. I do not believe government should dictate what we eat and where we eat it and when we eat it, as opposed to saying, here are a number of choices, let's inform the public, let them make their own decision, as opposed to legislating our free choices.
But the legislation is the standards. Like if the government doesn't set standards, then the food makers will just put whatever they want in them.
And what about the idea that the public has to pay for the outcome of obesity? Does that not give the public some right to try to control it?
I think there's a lot of sense in asking to hold the consumer responsible for choices they make. But in this situation, anything and everything in excess could potentially have health consequences. Perhaps the message should be, how do we educate the consumer that moderation or consumption in moderation is a reasonable approach, as opposed to limiting their choices?
That's putting a lot of emphasis on this poor consumer who, you know, really, there's a lot of poor food out there.
Linda, final word really quickly, about 20 seconds for you.
Well, final word, you know, we have to look at urban planning as well. If there's no grocery store near you and there's 10 McDonald's,
right,
then, you know, it's an easy choice.
Yeah. Thank you all for your insights tonight.
Thank you.
That's Dr. Donna Wilson, Professor of Nursing at the University of Alberta, physician and addiction psychiatrist Dr. Charles Alves, and in Calgary, physician and president-elect of the Alberta Medical Association, Dr. Linda Slocum. Thank you all.